Over the past 2 years, the pulse oximeter has become a crucial tool for tracking the health of COVID-19 patients. The small device clips onto a finger and measures the amount of oxygen in a patient's blood. But a growing body of evidence shows the device can be inaccurate when measuring oxygen levels in people with dark skin tones. A study published on Monday only adds to this concern. Researchers analyzing pre-pandemic health data also find those measurements resulted in patients of color receiving less supplemental oxygen than white patients did. "We were fooled by the pulse oximeter," says the study's lead author Dr. Anthony Celi, who's clinical research director and principal. "And what we showed in this study is that we were giving them less oxygen than they needed," he says. These sobering findings are bringing more urgency to educating patients and medical professionals about the shortcomings of the pulse oximeter, and to designing new models that can work reliably regardless of someone's skin color. It was last September when Dr. Sandra Looby-Gordon saw how this flaw in the device could affect her own family. Looby-Gordon, who's a physician at Boston Medical Center, found herself on the phone with a triage nurse at a Florida hospital, arguing that her own son, who was very sick with COVID-19, needed to be admitted to the hospital. "Well, yeah, he is looking pretty short of breath," Looby-Gordon remembered. She got off the phone with the nurse and spoke with other doctors at her medical center. One of them reminded her of a 2020 article in the New England Journal of Medicine showing the pulse oximeter tends to be inaccurate in people with dark skin tones. "On top of that, my son is, this sounds strange, but very dark complexion," says Looby-Gordon. Sure enough, later when her son was given a more invasive test for measuring blood oxygen, it showed his oxygen levels were actually dangerously low. He was admitted to the hospital, treated and ultimately recovered from COVID-19. But Looby-Gordon says most patients in their situation wouldn't know about the shortcomings of the pulse oximeter. Even as a black physician herself, she says she wasn't fully aware of how the device could be so misleading. If anything, the pandemic has underscored this long-standing problem with the pulse oximeter.